I would like to move on to you, Richard, now, because you're based in Tanzania and you work for CHAI, and George has spoken a bit about the challenges on a national level, but can we hear from you a little more about the challenges on a local level in Tanzania with the collecting and managing of data, and also a little bit about how you've overcome these? Over to you, Richard.
Thank you so much, Mia, for being part of it and being as a panelist. Yes, as we've been here, the stories of Tanzania, it's one of the countries that has been doing a lot in surveillance. And to be honest, they are thinking being on the pre-elimination stage. And with pre-eliminations means we need to strengthen a lot of surveillance system. So with the local level, there was the challenges that facing the country on how we can generate the information from the private sector, because Tanzania is one of the country whereby significant population who have fever, they do depend from the private sector. So we are lacking the information from the private sector. So a couple of challenges, but main I can say there was no proper user-friendly systems that can collect the information from the local level or from the grassroots level up to the nation. And also there was inadequate awareness of the private sector on the importance of data that they have to generate to the government. Also with the local government themselves, with the limited resources that they have, sometimes they do not have enough resources to conduct the interventions that can enhance the data accessibility from the private sector. So if we can rely with the availability of the data from the DHS2 alone, which are coming from the public health facilities, means we are lacking the information for those 40% of the populations who are getting the services from those private sector, private clinics, drug shops, and autonomous labs. So what have we managed to do it? We tried to introduce, together with NMCP and Ministry of Health, we managed to introduce a mobile phone-based integrated surveillance system whereby drug shops, autonomous labs, and community health workers, and even we can go beyond the school children, schools who have been receiving the trainings from the training of malaria from the schools. They can be able to send that information, and they can be available at the different administrative level. And also we were doing the technical advocacy with this funding from the Comic Relief and GSK. We were doing the technical advocacy, putting the governments at the local level, being the front in doing these project activities, including the trainings, supervisions, data review meetings across the project beneficiaries. But last but not least, we tried to this introduced system. We tried to scaling up to have the data from the other disease or health programs beyond malaria. For instance, in this integrated surveillance system, we have pneumonia, data from the drug shops, we have diarrhea, we have tuberculosis, and also we have neglected tropical disease information that we are working with NTD program so that we can collect also that information with this user-friendly system. But also we have family planning information that are generated from the private sector. So when you look at it, we are trying to be very innovative with the government, with the NMCPs and RSHS to generate this data and linking it in the national level so that this regional and council level, they can be able to be informed and taking the decisions.
Thanks very much, Richard, for sharing that. We're going to move on to Monique now. Just before that, I would like to just point out that if you hear background noise here from me in the background, there is a massive thunderstorm that has just broken out in Johannesburg. So if you're hearing background noise, that's what you're hearing. Monique, you work for a global organization, the Rollback Malaria Partnership. And I would like to know from you that in the current COVID-19 epidemic, how is the global malaria community use data to limit the impact of COVID-19 on malaria interventions? And to avoid resurgence in malaria cases and deaths? Over to you, Monique.
Thank you, Mia, for the question. And the Arabian Partnership to End Malaria through the Country Regional Support Partner Committee has organized regular calls with countries' National Malaria Control Program to provide status updates to and ensure continued support to country enabling timely bottlenecks, identification, and joint problem solving. This has included the development of the CRSPC tracker, we've compiled data received from countries and triangulate this data with partners' data. The information collected included the availability of malaria commodities, including diagnosis and treatment, the status of ITN, residual campaigns, and seasonal malaria chemoprevention. But also the technical assistance support as well as identification of any malaria upsurge are also included in the CRSPC tracker. And also what is really important, the CRSPC was able to use this tracker to support countries to reach out to partners for solutions and to ensure challenges and risks are identified early, allowing a timely response. As a result of the sharing of data in this way, country challenges receive increased visibility among partners and funders, and negotiation with funders, procurers, manufacturers, suppliers, and shipping companies was facilitated. We can give some good example, for example, with high political level discussion, example with Minister of Health at country level, we were able to advocate for the continuation of malaria programming during the COVID-19 pandemic. And this allowed the National Malaria Control Program across Africa to continue with the planning and implementation of some key campaigns, whilst ensuring COVID-19 safety protocols were also used. And also this tracker helped especially to solve issues and provide solutions. Example for mobilization for airlifting commodities, working with manufacturers, procurers to fast track orders. And in some cases, borrowing of commodities between countries, such as between an example of Gambia and Senegal, Burkina, Mali, and Niger. And we are still continuing to encourage countries to track stock availability, place order early, and where possible, include additional buffer stock as commodity delivery times continue to be impacted by COVID-19.
Thanks, Monique. We're going to move on to Joy now. Joy, you work for ULMA, and it's an organization which represents heads of state fighting malaria. So you deal with leaders on a national level. How have you linked up data with national decision makers, and has it resulted in driving forward political engagement and accountability for health and malaria?
Thank you so much, Mia. Appreciate the opportunity to be on the panel. Since its creation, the ALMA scorecard for accountability and action that was mentioned by His Excellency President Kikwete has been presented every quarter to the political leaders, that is the heads of state and the ministers and the ambassadors. And they have been able to use it not just to track progress, but also to identify the areas where there are bottlenecks, where action needs to be taken. And it has actually led to enhanced domestic resource commitments, and also resource mobilization, like we are seeing now in some countries from both the public and the private sector. It has led to rapid policy changes where they were required, and accelerated commodity procurement, and led to action which has been able to address emergencies, that is disease outbreaks as they occur. We have supported 40 countries to develop their own scorecards and management tools, as you saw in the Tanzanian video. And these are used by the Ministry of Health staff at national and subnational levels to track progress, monitor the implementation of key interventions. And it has led to significant action and impact, with countries using real-time data to respond to outbreaks, addressing shortages of staff, addressing shortages of commodities, improving the quality of care, particularly with the use of the community scorecards. Scorecards have also facilitated increased collaboration in financing between the private sector and the public sector. In Zambia, for example, the analysis of the scorecard led to provincial leaders being able to realize the proportion of pregnant women receiving preventative treatment for malaria, and that it was extremely low. And this was presented at the National and Malaria Council meeting, which is a multi-sectoral forum chaired by the Minister of Health, and it was used to advocate for funding to procure the drug that is used to prevent malaria in pregnancy, SP. So we are finding that the sharing of the health data is actually an empowerment tool for leaders and for citizens as well. It gives them the ability to be able to assess issues. It helps them to hold people who are responsible accountable. And we have numerous examples in Ghana, in Ethiopia, where community members, health workers, partners, and governments have been able to work together collaboratively to solve problems. Earlier this month, the chair of ALMA, President Kenyatta, launched the Scorecard Hub as part of his agenda for accelerating digitalization, that is the use of real-time data to inform decision-making. And already we have countries that are sharing their scorecards on this platform, which is an open platform for everybody, for partners, for students, the media, to be able to assess this information and learn from it. And he's in the process right now of actually personally himself writing to every head of state to encourage them to share this data openly and democratize data. We are hoping that the hub will also be extremely useful in engaging young people, so that they can be encouraged to become researchers and to develop professions in this particular area.
Thanks very much, Joy. I have another question for you. So we've heard now about community scorecards, and we've heard about mobile surveillance systems. But something that became really prominent during the COVID-19 pandemic is dashboards with all cases and deaths being displayed. And the public has gained a very much bigger interest in these type of numbers. So can you maybe share with us, why is it important to so widely share health data? And have you seen that this type of data can strengthen accountability and drive actions to improve health outcomes?
Absolutely. Information is power. I think we all know that, particularly when it's accurate information, not misinformation. And the benefit of this real-time data, making it available, is that first of all, it teaches us to collect information, teaches us to make sure that the information is accurate, and it also teaches us how to use the information in order to inform decision-making, to inform policies, and to design programs so that they can better suit people. And apart from that, it just helps people to assess whether they're making progress or not, and which is what the massive amount of information that is now available in terms of dashboards that you're talking about for COVID-19. People, use them to assess which countries are making progress, where the challenge is. I looked at one map this morning, which showed just a sliver, just a few countries in Africa that are now vaccinating against COVID. That is important information so that people can know, you do the bottleneck analysis. What is the challenge? Why is there no COVID vaccine? What can be done about it? So it encourages people to take action. And that is really the big contribution that real-time data has. And I want to thank my colleague Richard for what he talked about, bringing in the private sector data. It is extremely important, and because a lot of community members in Africa actually rely on the private sector rather than the public sector. And it is absolutely important for us to have a balanced picture, to really understand where the challenges are, to have a comprehensive set of data.
Thanks, Joy. That's a great lesson, and great to hear that the data leads to action for policymakers and to design good programs. So, George, we've heard about data that leads to action now from Joy, but how can we use data in national malaria programs to make sure that quality surveillance of malaria prevalence continues during the COVID-19 pandemic so that we don't lose the gains that we've made so far?
Okay. So I think to answer your question and to share the Kenyan experience, as a country, we had planned to conduct a malaria indicator survey early last year when we could not do it because of now the containment measures that came along with COVID. We had to rapidly be able to adjust our plan of action. We had planned to do it in the second quarter of last year, March, April. We did it in the fourth quarter, November, December. But also, we had also planned to do a mass net distribution around the same time, and indoor rescue spraying, all of which were delayed. So I think to be able to keep track of the trends for malaria, we really embarked on sensitizing the counties together with the disease surveillance and response unit to enhance our disease surveillance, use the real-time data sources that we have to be able to track any upsurges in cases. Because we know, obviously, with the delayed interventions, prevention interventions, the IRS, the mass net distribution would have expected an upsurge in cases. So in each and every of the fora, we were able to at least ensure that we sensitize people on the need to have enhanced surveillance, on the need to analyze our data in real time and be able to use it on decision making. I think the second point also was to ensure commodity security, using our commodities stocks dashboards that we have, again to ensure that we do not run short out of commodities. But as a country, we noticed a trend. Of course, due to COVID containment measures, we had reduced outpatient hospital attendance. So we saw our malaria incidents reducing from 96 per 1,000 to 84. But because we knew that a lot of people, with the issue of the containment measures, the issue of the way fever could have been perceived to be managed, because for us, everywhere you go, you have to have a temperature taken. And if you have a high fever, then of course you have to be screened for COVID and before you're managed for others conditions. So we tend to think that people also shied away from participating, from going to health facilities when they had fever, and maybe sought treatment from private pharmacies for medication. So we're also able to do a quality of care survey amongst our private healthcare providers, again to ensure that they're able to follow our guidelines of testing first for malaria before treating, to ensure there is no presumptive treatment, which is what we anticipated happened. So I think largely for us is that we really emphasized the role of surveillance at this time of COVID to ensure that we do not get caught up. And we found in one or two locations, sub-counties within our country where we had seen an upsurge in cases, and we're able to adequately respond. So I think also moving forward as a country is also to ensure that element of the epidemic preparedness and response and enhanced surveillance, to be able to ensure that we have the right commodities at the right places and at the right time to ensure that we are not overtaken by an upsurge in cases. Over and thank you.
George, before we move on to Richard, I think someone, it looks like someone with a name that's registered, Yita Yal, is not on mute, and we're hearing background noise coming in through that. Thank you. I see you've muted yourself. Thank you very much for that. So Richard, I have a question for you. Is there anything that your work on malaria surveillance at the community level and with informal private health services can teach us on how we can strengthen such systems in Africa?
I think there is a very good lesson that we have learned from this 5 years Comic Relief and GSK funding in Tanzania when we deploy this system, because it has been shown that it has been well taken by the government themselves, because previously there was no formal system that can generate or can collect data from that grassroots level, from the, as I said, 40% populations that rely to. So we need to integrate the national level, and it can help in the health plannings. And the good enough, it's even technically, it's very, it's not, it needs a rocket science in order to generate that, because for instance, for us, we utilize the same government structure using the same DHS tool, and also even the means of collecting data through the mobile phones. They are using the platform that normally in Tanzania they're using with the mobile, money transfer through the mobiles, which is very popular in Africa, like M-Pesa or Tigo Pesa, like. So with that, you don't need any like a strong advocates for them to ensure that how to or to tell them like this is the way to send the information. But in order to make the other African countries to learn, I think first they need to appreciate that the surveillance system, it has to be a core interventions rather than just support interventions, like Tanzania now taken as a core interventions. And also government have a role to ensure that the decision relevant indicators are also included from even the private sector system to taking it to the high level. We have seen a lot of African countries, they have a lot of tens, thousands of systems. Every partner, everyone can generate their own system from the private sector by using only 1, 2 indicators. And this was been seen in Tanzania last decade. But now we have tried to remove or to reduce those numbers of the parallel systems and being integrated into one platform. And this, it's a credit to NMCP of Tanzania. But the government, if in order to ensure that these things, to have a system is one thing, but how we can ensure that a consistency of getting this data, the government should be able also to show those people who are sending the information from those grassroots level, that their data
Richard, sorry,
they are used and they can make decisions. We have seen that
you were cutting out for a bit. So can you go a little bit back and just repeat for us what you were saying about 40 seconds ago?
Yes, I was saying we've seen that to have a system is one thing, but to ensure the data are consistently coming into the national level, regional, or at the council level, it needs like a special way to do it. So for our 3 or 4 years experience of this system, we have tried to show those private sector what is the meaning of their data, they're sending it. So through the data review meetings with them, with those senders, can make them to be aware, and you can make like a non-monetary incentive to them so that they can continually sending the informations at the national level. So I think this is very important for government to do that. But another thing for the African governments to do to ensure that this is consistent is to ensure that the strong regulatory and governing process are there in place. For instance, in drug shops in Tanzania, there is a regulations that are saying that whatever the information that is needed by the government should be shared timely according to the government the way they have said to them. But if you don't strengthen this or enforcement of these existing regulations, people or the drug shops or autonomous laboratories, they can take it for granted. Like, okay, wow, what do I see the importance of this one? What will they do if I don't send it? So with this experience that we do, the government itself, they have a role to do it, but it's not like a bigger one that to do it. But if they can try to introduce the system, which is user-friendly, like last mobile, you can get every information that you need, and you can better position, or you can better plan whole health interventions, considering that populations that are attended in the community settings, like drug shops, autonomous laboratories, or the work from the community health workers.
Thank you, Richard. Monique, we have now heard from Richard about the importance of systems and how we can use mobile systems effectively, but how can we use technology to help improve surveillance and data management? And are there any data innovations that we're going to see in the near future that's, going to come up? Monique?
Thank you, Mia, for the question. Actually, even with the COVID-19 pandemic, this situation brings the whole world using technology. Yes, I can confirm that technology can improve the surveillance at country and even at regional levels. A good example is that in 2020, during the pandemic situation, some countries were able to digitalize the IT and mass campaign distribution. With Benin, who is the pioneer, and with a good publication in a scientific journal. This approach allows to have real-time data and have on time the achievement of the intervention and address some bottlenecks occurred during the campaign, and during the campaign and in real time situation and solving issue. Countries are moving to the digitalization of all campaigns, either ITN or SMC campaigns in the future, and with the support of all partners. And also RBM is moving with the operationalization of the global dashboard, which will provide a real-time data for access by countries, partners, and all malaria community for information and action in order to achieve the GTS goal by 2030. In collaboration with WHO, in 2018, RBM launched the HBHI approach. And one among the intervention, it was to support countries to have evidence-based data. And countries, the 11 selected countries at that time were able to use data at country level to just produce a new epidemiological profile of the country using the stratification. And this leads to the identification of the epidemiology at national and decentralized level with a proposal of a mix of intervention to implement at each level in order to decrease the burden of the disease and achieve also the target set in their respective malaria strategic plan.
Thanks, Monique. I have another question for you. If you think about your experience this past year, what would be your one recommendation or learning that you would like to share with colleagues from organizations or governments across the continent to consider for their work in this area of data collection and management?
Yes, thank you, Mia. I can say that governments are more and more utilizing data in all aspects of their functioning. Creating a view at a glance can provide transparency about the situation, combined with the ability to drill down to details to really understand the data and conclusions that may be inferred from it. Real-time data can enable operational strategies based on specific situations and immediate decisions. And also the transparency of relevant information on dashboards in real time can improve the efficiency of operations with better management of many situations. The efficiency makes people trust to trust the dashboard, improving the effectiveness of the operation in the short and long term. Relevant information gives people the opportunity to participate in public decision-making and policy-making.
Thanks, Monique. Joy, I would love to ask you the same question. If you think back, what is the one thing that you think that you've learned that can really help governments, other governments in Africa or other organizations when they collect or manage data?
I definitely agree with Monique. There is an urgent priority for countries, political leaders, governments, development partners, private sector development partners to ensure the highest level of commitment and sufficient investment to develop harmonized real-time quality data systems that can inform decision-making and enhance accountability. I mean, this pandemic has also taught us that this process must be fully integrated, it must be institutionalized, and it must be stable and sustainable. So that there can be no time when there are gaps. It is also crucial that this data must be democratized, like Monique was saying, translating it into information that is easily understood by the public, and encourage the public to use this data, to debate about it, and to use it in order to inform their own actions. So, because when data is made available to the public, accountability is enhanced, but it is not just enhanced, it is also embraced as part of democracy and as a way of life. We saw what happened when during the COVID pandemic, when there was sustained criticism about the lack of PPE. You know, people started manufacturing PPE everywhere, you know, and then now it's a question of the quality of the PPE. Now there's a focus on quality. This is the power of democratization of data. So I really feel that we are at a crossroads, and we have a huge opportunity that we should all take advantage of. Yeah.
Thanks so much, Joy. You've really summarized it so succinctly. We must democratize knowledge, which is a really powerful concept and something that we can really learn from. We have come to the end of our session now, or close to the end. I would like to thank all of our 4 panelists for their enormously valuable contributions and for their willingness to share practical examples of the lessons that they've learned. It is so useful to learn from examples rather than just from concepts.